and welcome back to another video. A lot of people might be asking, why are you doing videos on like sex education? I saw a lot of people commenting when I suggested it on my Twitter, like, why would you ever want to do a series on sex education? Is that really necessary? And my answer to that is, it is absolutely and entirely necessary. For someone who went to an Islamic school, our only form of like sexual education was people warning us that having sex before marriage is a bad thing, and also being gay is a bad thing. So I thought that maybe doing a little sex education session would be good. And I would like to kick it off by telling my story of myself getting an IUS. Now, I fully understand if people find this like way too TMI, too much information, like this is gross to them and they don't want to watch it. That's fine. I'll see you in the next video. Bye bye. It's also my currently it's my summer holiday, so I'll probably have more time to make more videos anyway, and I'm going to try and aim to make more videos in the next 2 months. Because I generally don't have very much to do at the minute. But I would like to do this as a series, and I would like to go over different things. And the way that I have decided that I want to go about doing this series is that I'll talk a little bit about a form of contraceptive, and I'll then research alongside with you. This is also not my laptop, so there might be different laptops depending on the video. But I thought that maybe we could research together on what different contraceptives were, if you wanted to, if that's a good idea. But I just want to start by telling you my experience with the intrauterine system, I believe is the full name, but a form of contraceptive that I got done a few days ago that I feel like finally sort of recovered from. So it's something called an IUS. Another form of it is an IUD, but that one is a copper one. The one that I got put in is actually called Mirena, and it is a hormone-based coil, which is technically it wouldn't be a coil, because the reason the coil is called a coil is because it's actually coiled copper, and the way that it works is that it kills off sperm. The copper does. It's completely poisonous to sperm. The one that I got done is hormonal, so it just puts like a lining over the uterus so that when the ovum comes out of the ovaries, it tends to just sort of slide away and not attach, even if it does fertilize. So I'm going to draw a very unscientific diagram of the uterus, of female genitalia, which should be fun, but it's not. It should be common knowledge, but it isn't. So here's my highly scientific diagram of the female genitalia. So these are the ovaries, and out of the ovaries there come like little ovums, and each month one will come from here, and then the next month this one will come from here. And that's how periods work, is when these don't get fertilized, the uterus, which is this part, it grows a lining. And this is what's shed at the end of your menstrual cycle, which is what a period is. So if this ovum is fertilized, it will stick to the uterine lining and then become a baby. But if it's not fertilized, then the uterine lining sheds and it becomes your period. Now, what the IUS does, to my knowledge, I might be wrong, is that it creates a slippery lining on top of the uterus, because this is where it would be. So here, if I draw another triangle, here is where the coil will be, right? So this has hormones in it, or my one does, and it just makes this lining slippery so the ovum can't attach. It just can't do it. And the copper coil, which is a different one, and the one that I did not get at the end, it just kills off sperm. That's its entire purpose. But yeah, and the process of it was, I didn't expect, like, I had researched it thoroughly before I got it done. I thought it was going to be just going to be fun. It was going to be easy, quick, done. But it is almost like a minor surgery. I mean, they didn't have to cut anything, but it's invasive because they have to put it up in there. And this little close or gate here is called a cervix, which is quite difficult to put anything through. So they had to like shove a plastic piece of something up through there. And it was really quite invasive. And even though I knew everything that, because okay, so basically what happened was that I had booked this appointment months in advance. So I had booked it for the 1st of July, and the people there, it is a specialized sexual health clinic, so they knew what they were doing. And the first thing the lady did was she sat me down and made sure that I understood what was going to happen. So she explained the different types, and there's also different types of IUSs. There's Mirena, there's newer ones coming out, there's another one, I've forgotten what it's called, but there are different types, and the different types have different like side effects and different things that they do, and they last for different lengths of time. Mirena lasts for about 5 years, which is, yeah, they gave me like a date with a card on it, as if I'm going to remember that. But it lasts for about 5 years, and then they have to take it out and put a new one in. There are other IUSs that only last for like 2 years or 3 years. There are newer ones being developed that also last for 5 years. IUD typically lasts for about 10 years. But I didn't get that done, so I'm going to stop talking about the IUD. So she sat me down, she talked me through all the different options. She made sure that it was suitable for me. So for me, for example, I get a lot of migraines, and one of the contraceptive pills that I was taking, like daily contraceptives that I was taking, was just giving me migraines. And I told that to her, and she was like, oh, okay, then Mirena's fine for that. If you had that on that contraceptive, it's fine, even though this one releases hormones, so it was something that I was really worried about. But yeah, she explained the entire process. Then she was like, go and take your clothes off, and then you can come on the bench and we'll put it in. And they were very, very understanding. They put like, even though it didn't fucking matter, they put like a curtain in front of like a little room, and they allowed me to take my clothes off. And she said, put this, it was basically like a large sheet of toilet paper. Just put this on top of you so you feel comfortable, and then you can come onto the table and we'll implant the coil into you. So I sat up, and she talked me through the whole process. It was, I wasn't put down for it. You wouldn't have to be put down for it. But basically she had like this plastic tube that she put her finger in, and they use it to widen the vagina. So the vagina is, unscientifically drawn, is this part. It's just below the cervix, and it's the little entrance up into, I guess your fallopian tubes. And she put like a little plastic piece up in there to widen it, and she also had the coil in her hand, and she was trying to find my cervix, and apparently my cervix is located far to the right, so I'm extremely halal apparently, but my cervix was like turned straight up into the right. And the IUD, when you look at it, it's shaped like a T, and at the bottom they have like these little threads that you can feel, and they just like, it's just like there, and that's how you know that the IUD is in place, or the IUS, or let's just call it a coil. So you know that the coil is in place when you can feel those threads, and initially before they even start the treatment, they get you to feel the threads so you know what they feel like. But that's what it kind of, it's not extremely scientific, I know, but that's what it kind of looks like. So she had to implant that into my cervix, and it felt very invasive. It felt very, very invasive. I felt violated, and she was like, look, if you want us to stop, we can stop. And I'm not here for that. I become very, I'm very competitive when it comes to pain for some reason. Like, if I'm in pain, if I have something going on and I just want something over, I will just sit through it no matter how much pain I'm in. But it basically feels like, once it's implanted, it basically feels like a very severe cramp. Like, it feels like a really bad, like, shitty period. That's what it feels like, and it really hurts. Like, while she was implanting it, I like giggled for it was like a nervous giggle, and it hurt so bad. It hurt so bad to do that. So yeah, it hurt. And then after it was implanted, she like removed everything slowly. So the bit of plastic that she had, it wasn't this, but the bit of plastic she had to keep me open, she like removed it slowly, and then she was like, don't get up all at once. And I was like ready. I was like, I'm out of here. Like my fight or flight response was just kicking in. I just wanted to leave. And she was like, don't get up all at once. So I just laid back, and she was like, just stay on the table for as long as you want. Like, let everything settle, and then when you actually want to get up, then like slowly get up. I did something stupid. Now, I had read that when you get this implanted, they give you a local anesthetic. But what I did not realize is that the rest of my body is gonna feel pain. So that muscular pain when she put it in, and I had that cramp going on, I thought that was gonna be completely not there, and it was stupid of me to think that. And she was like, "You should have taken some painkillers beforehand." So anyone who wants to get any coil implanted, just remember to get an implant. Sorry, not an implant. Painkillers. Remember to take painkillers because it hurts a lot. So as soon as I was off the table, I put my clothes back on. She like gave me all the literature that I needed. Yeah. Basically, she sat me down. She gave me this saline that was like very sugary, and it was supposed to like just, I guess it was like it had like the it had like the effect of giving a kid a lollipop after they went to the dentist. Like that's the effect that it had. It was just like a sweet drink that just made you feel better. And I drank like a ton of water, and then Ed was waiting for me in the waiting room, and I was face pale, like I just wanted to go home, and he was like, "Are you okay?" And I was like, "Yeah," but the doctor told me that to stay in the waiting room for like 10 to 15 minutes in case something happens, and I didn't know what was going to happen. She said that sometimes if it's misplaced, then it can pierce the wall of the uterus, like it can perforate it, and you can bleed quite heavily, and sometimes the body just rejects it because it's a piece of plastic that's not meant to be in your body. So you can just end up passing it on its own, which sounds terrifying. So I just sort of waited around in the waiting room for about 10 to 15 minutes. Ed gets really nervous around anything. Like even when I was getting my piercings done, even when I was getting my tattoo done, he gets really, really nervous about around stuff like that. So he was like, "Do you want anything? Do you like?" He was just stressing me out basically, which is good, which is fine. It's healthy for him to do that, and it's really nice that he does stuff like that. But it does genuinely stress me out because he's like not okay. But yeah, so I had to just sort of wait around, and it was just like this terrible cramp, and I had taken painkillers after the surgery after it was implanted, and it didn't help because the painkillers didn't kick in until like 20 minutes later, and we had to walk home, and the lady was like, "Don't do any strenuous activity, don't have sex for 3 days, don't like use protection up until 7 days because the implant won't start working until 7 days. Your body won't have acclimatized to it. So just be careful for 7 days and use protection so you don't get pregnant, da 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 da." You know the spiel. And yeah, and then I went home and I just like had a hot pad or a water bottle just resting on me, and I was just chilling out. Like she literally just said, "Don't do anything today." And I didn't. And the next day I just kept falling in and out of a nap because it was so painful. Like I was in so much pain. But it's like that bad period pain. It's not like a stabbing pain or like heavy, there was no heavy bleeding. It was just like light spotting. And she said, basically the reason that there's a light spotting is because that uterine line, that lining that you might have growing, that's just shedding slowly. And then that mucousy film will start growing on it, and then your babies will not be able to implant on there, and that's how the contraceptive works. But yeah, it's normal to experience shedding and also periods for 3 to 6 months. And for someone like me, I have polycystic ovaries, which I might make a whole other video about. But I have polycystic ovaries, so that means that my periods are fairly not regular. So that might regulate them a little bit. But a lot of the time, people who have this coil implanted, they just stop having periods after about 6 months. They just stop until the implant is taken out. And from what I've read, people who want to get pregnant after using this implant, they can take it out at any time, and the menstrual cycles and your rate of fertility is about the same as people who have never had the implant in. So yeah, it seems like a pretty good option for contraceptives, especially if you don't like taking pills, or if you don't want to get injections, or you don't like condoms, and you have one partner. Obviously, if you have multiple partners, you should still use condoms, because none of these contraceptives, they're only for stopping pregnancies. None of these contraceptives will stop you from having an STD. So if you have multiple partners, it's very much advisable that you use condoms. And yeah, we might make a whole other episode on condoms, I don't know. But that's my story. If you wanted to stick around for this part, I might just do a little bit of Mirena research so that you guys can get the extra information that you might need, and my haphazard drawing of the female form was not too distasteful for you. But we'll just do a little bit of research on the IUS. So we'll just look at the NHS website, which is the National Health Service in the UK, which we are very, very proud of. So it says that an IUS is a small T-shaped plastic device that is put into your womb or uterus by a doctor or nurse. It releases the hormone progestogen to stop you getting pregnant and lasts for about 3 to 5 years. 2 brands of IUS are used in the UK, so that's Mirena, and the other one is called Jadis. And Mirena lasts for 5 years, Jadis lasts for 3 years. So facts about the IUS: when inserted correctly, it's more than 99% effective. It can be taken out at any time by a specially trained doctor or a nurse. It's possible to get pregnant straight after it's removed. It can make your periods lighter, shorter, or stop altogether, so it may help women who have heavy or painful periods. It can be used by women who can't use combined contraception, such as the combined pill. For example, those who have migraines, which was me. I used to get migraines on the combined pill. Once the IUS is in place, you don't have to think about it. Some women may experience side effects such as mood swings, skin problems, or breast tenderness. There's a small risk of getting an infection after it's been fitted, and the advice that the nurse gave me was to not go swimming for a little while, about a month. Taking a bath is fine, but not to go swimming where people share the pool, and also not to have sex immediately, like within the first 3 days, because there's a risk of infection. Which is good advice, and I will share that with you. It can be uncomfortable when the IUS is put in, as I have explained, but painkillers can help. The IUS can be fitted at any time during your monthly menstrual cycle, as long as you're not pregnant. That is something I forgot to mention. As long as you're not pregnant, you can literally fit it at any point in your menstrual cycle, even when you're on your period, apparently. The IUS doesn't protect against STIs or STDs or sexually transmitted diseases, so you may need to use condoms as well. So yeah, let me just see if there's anything else that I might need to add to this. A lot of this I've covered already. Okay, so who can use an IUS? Most women can use an IUS, including those who are HIV positive. A GP or nurse will ask you about your medical history to check if an IUS is a suitable contraceptive for you. The IUS may not be suitable if you have breast cancer, cervical cancer or womb cancer, liver disease, an unexplained bleeding between periods or after sex, arterial disease or a history of heart disease or stroke, an untreated sexually transmitted infection or pelvic infection, problems with your womb or cervix. And I'm guessing because it has to be inserted through the cervix, it might damage the tissue that's there. So that's probably why. An IUS can be fitted 4 to 6 weeks after giving birth, and it can be fitted after having a miscarriage or an abortion. Disadvantages and advantages. The advantages are it works between 3 and 5 years. It's the most effective form of contraception available in the UK. It doesn't interrupt sex. Your periods can become lighter, shorter, or less painful. It's safe to use an IUS if you're breastfeeding. It's not affected by other medicines. It may be a good option if you can't take the hormone estrogen, which is used in the combined pill. It's possible to get pregnant as soon as the IUS is removed, and there's no evidence that the IUS will affect your weight or increase the risk of cervical cancer, cancer of the uterus, or ovarian cancer. It's actually stated that it might decrease the risk of those cancers. Disadvantages: your periods may become irregular or stop completely, which may not be suitable for some women. Some women experience headaches, acne, breast tenderness after having the IUS fitted. I've only experienced breast tenderness. I haven't experienced headaches or acne so far. Some women may experience changes in moods and libido. These changes are very small. I have experienced some change in my mood. I'm much more sleepy, and it's actually a side effect that your depression might increase. But as long as you know how to deal with your depression, then you'll be fine. Which I'm one of those people. An uncommon side effect of IUS, and this is like 1 in 100 women or 1 in 1,000, is that some women can develop small fluid-filled cysts on the ovaries, and these usually disappear without treatment. They aren't cancerous cysts, they're just water-filled cysts that burst and then disappear. An IUS doesn't protect you against STIs, so you may need to use condoms as well. If you get an infection when you have an IUS fitted, it could lead to a pelvic infection if it's not treated. And most women who stop using an IUS do so because of vaginal bleeding and pain, although this is less common. And again, this is like 1 in 100 or 1 in 1,000 women, simply because the IUS like turns or is misfitted, and things like that. The risks, which I've like touched on lightly, but I've got the NHS website in front of me, so I'll give you their information instead. The risks of the IUS is the pelvic infections, which we've mentioned, and usually there's a small chance in the first 20 days of the IUS being inserted, and it's recommended that people check the threads that I was talking about once a month to make sure that the IUS is still in place. But this infection, mainly the main symptom to look out for is heavy bleeding, because normally the IUS doesn't cause any kind of heavy bleeding. The other risk is rejection. So like I said, sometimes the body is just like, I don't want this in me, and just pushes it out. It's the same with piercings. If the body doesn't want them there, it literally physically pushes them out of you. And that's also another reason why you check if your IUS is in place, because the body might be rejecting it. Damage to the womb. So in rare cases, an IUS can make a hole in the womb when it's put in, and this may be painful, but often there are no symptoms. The biggest one, again, to look out for is heavy bleeding. If you get an IUS fitted and you experience some kind of pain, or you think that your uterus has been perforated, then you should go to the GP immediately and have it removed. A lot of nurses and sexual health clinics can get that done in the moment. If not, then A&E is the one to go to, accident and emergency, or the ER, the emergency room. Ectopic pregnancies are more likely if you have an IUS in. If the IUS fails, which it's very unlikely that it will, it's almost over 99% accurate, 99% over 99% chance of not getting pregnant. But if the IUS fails and you become pregnant, there's a small chance that you will get an ectopic pregnancy, which is where your pregnancy, instead of normally happening here in the uterus, it happens here in the fallopian tube, which the fallopian tube isn't made for that. So yeah, and where you can get the IUS is contraception clinics, sexual health clinics, GP surgeries, and some young people services, because you can get this done even if you're under 16. I don't know why you would, but no, you can get it done even if you're under 16. But yeah, that is all the information I have on the IUS from the NHS website. And from my own experience, I hope this has been in part helpful. I remember someone saying that they have a lot of medical health problems, so they go into the MRI scanner a lot. The IUS actually has really small amounts of a metal, so it can be picked up in an X-ray, but I'm not sure about an MRI. It depends where you have this injury on your body that you keep getting sick for, because if you're only getting your head scanned, I don't think you'd have to worry about the MRI picking up on your and also you can tell the doctor, hey, I have this in, I don't want my family to know about it. Doctors tend to be very confidential about their patients. It's part of good practice, so yeah. But if you want to avoid that, we can explore other forms of contraception, because I was never taught any of this. I had to do my own research like this and then figure it out for myself. So I would like there to be a resource for people who had to go to shitty Islamic schools where they didn't teach us anything about anything. So yeah, I hope you found this helpful, and I will see you in the next one with more characteristically poor drawings of scientific anatomy, and looking at websites to see the uses and purposes and poorly read things of contraceptives and sexual health. So yeah, there you go. I'm just gonna stop. I'm not in sorts today. I'm sorry. Goodbye.